Can we just talk about how nobody wants to wait 6 minutes into the video for you to take your shirt off? My results totally, I'll be so real on this, my results would have been better if I knew how to meditate and tap into that profound sense of the mind-body connection. My name is Ashton Colby. If you haven't subscribed to this channel, I have been transitioning for 6 years. I got my top surgery 5 years ago, and as well, I'm getting my yoga certification. So I talk about the mind, body, soul, all that jazz in connection to the trans experience in order to make you have a beautiful, thriving life beyond the physical changes, and really keep the intention clear that we're doing all the physical changes in order to be happy and thrive and like rock out on life. Is that not it? Is that not why we're here? So the physical changes are important, so let's do a video about that, since I haven't done it in a while, and all the videos I've been doing lately have been very esoteric and maybe woo-woo for some people. So 5 years post-op, Dr. Garramone in Florida, 2013, May 23rd, 2013. This is what we're rocking with now as it stands. I will go back here. You know, it's chilling. It's chilling. I'm happy with it. I'm super happy with it after 5 years. I will say I'm right-handed. This side gets a little more red sometimes. It is very common for the pigment to not entirely return. So this half, if you see, I got that half tattooed, as well as I got this one outlined, because it really, I'll show some pictures. It caused me a lot of dysphoria. It was 3 years until I got myself to go get it tattooed, and after I got it tattooed and had my nips filled in, I feel so much better about my chest. It is like a new chest to me. I recommend anybody who's hanging out and you know, it's already been like a year or two or whatever post-op, like, and you're feeling some type of way about your nips, just go get them tattooed. I went to a watercolor tattoo artist just at a tattoo shop, but it's like a reputable shop. They have the ability to custom blend ink for you, and I only paid like $80, and I swear it was one of the best decisions in my transition that I've ever made. Totally recommend it. I don't know why more people don't do it, because it was the relief of dysphoria that it gave me to get my nipples tattooed was the equivalent to like literally getting a surgery. I felt so much better about my chest. I recommend it to anybody. We got to talk about nipple tattooing more, so if you have a question about that, leave it below. I read all the comments. I will say as well, since I'm a yoga teacher and I talk about the mind, body, all that stuff, I really want to be clear that like I was flexing, and like this is me flexing, and like this is me flexing, but like me just chilling is like this, and that bodies look different. Like this looks different than like this, ba-bam. And we have this like, you know, a thumbnail. I gotta play the YouTube game, and like people click on this shit if I'm like this, but the reality is, let's be real, I was just to like, that was just to emphasize the chest, the pecs, blah blah blah. But like me chilling, it's just like this, like, but we can go like, ba-bam, you know, like, but we gotta like, on Instagram and everything like that, I gotta put a little disclaimer in here that we really compare our top surgery results to a lot of people that, one, are years beyond us, and then also just, we compare it to like filtered and flexed to like our just like normal chillingness, and bodies are rad in any way that they reside, so gotta put that out there. So yeah, like I said, on this channel we do talk about things that like the mind-body connection as well, and I did make a video just recently about how I don't think I was ready for top surgery, and I know that it was really because I didn't have this, I was really internally fighting my body. Like I really felt like top surgery was gonna fix something that was broken versus just like helping me express something more, and I know I had inflammation as a result of that, more like it keloided. And really, up until like 3 years post-op, I had a lot, like, of puffiness, and it wasn't until like 4 years post-op that stuff started to like chill out and give me this kind of vibe. And that was really in line with me like chilling out a little bit and relaxing and let my body just do its thing, and not like internally, like mentally fighting my body. And I know that my results totally, I'll be so real on this, my results would have been better if I knew how to meditate and tap into that profound sense of the mind-body connection. I'm going to be doing, by request, a guided meditation for healing from top surgery, because really, if we can reach a state of calm, and I mean, this is being proved by neuroscience, this isn't as woo-woo as people may seem. You know, Western medicine is catching up to like Eastern philosophy, that we can really heal our bodies and have a lot more power over our bodies than we think we do. And a lot of the narratives that we have about trans experience and top surgery and all of that is that like there's something wrong with you and all that, and it causes this discord. And so I know that for me personally, and maybe this resonates with other experiences and what I've seen, just observe, no judgment here, just non-judgmental observer of other things, that I see that there's a reason why some people have more inflammation and all that, and it really definitely ties back to state of mind type stuff. So it's really important, and that's why you gotta subscribe to my channel if you want to really go deeper. So yeah, so we talked about these scars, inflammation, mind-body connection, talk about the nips tattooing. If you have any more questions specifically about my experience or anything like that, I will of course make like a Q&A, frequently asked questions, all that jazz, because the physical changes are just as an important component as the emotional, spiritual, intellectual changes. It is all together in order to kind of peek you into this jam of changing gender dysphoria into a state of gender euphoria, spelled Y-O-U, euphoria. That's my jam, gender euphoria. So subscribe to this channel so that we can rock it out and go deeper, because the people that are jamming on the stuff that I'm talking about are really craving this stuff, and realize that it is just like so static and so surface level to just give me like telling me about just top surgery or just the physical changes, because we gotta go deeper. There is transgender people in emotional pain right now, and it comes to the fact that they don't have the tools, because nobody's talking about this deeper stuff. Like, what do you do once you've gotten so many physical changes and there's not any more changes that you can really like do per se, or it's like, when is it enough? And it's like, that's when the real work starts internally. But if you're doing it from the beginning of the transition, or integrate that and realize it's an integration of the mind, body, soul, and spirit, and it's all one thing, and it's not just like, when I get the physical changes I'll be happy, and you want to learn how to like do the thing, like, then you've come to the right place. So I love you. You can follow me on Instagram. It's just Ashton James Colby. That's the place to connect. I read all the comments. I love connecting. I love having conversations with you. I love people that are like on my high vibe and jamming stuff, that want to just like go there and talk about the esoteric stuff. But then it's also like, yeah, top surgery, it's a surgery, let's talk about it. So I'll answer questions about testosterone, because I've been on testosterone on and off and all that jam. A 6-year journey of testosterone since 2012, June 4th, 2012. I love you. Stay awesome. Have a great rest of your day.